Thank you, Corey, for having us on this afternoon. And I want to thank all of our media partners for joining us this afternoon. And I want to thank our Washington Department of Health team who are going to provide some very important updates to the state and to our community members. And I know a lot of people are really interested and concerned about what's happening across Washington with COVID-19, which is going to be the main focus this afternoon. So as mentioned, my name is Umair Shah. I'm the Secretary of Health for the state of Washington, and it's my great pleasure to be here this afternoon. I hope everyone had fantastic holidays. I know it's been a very difficult time for all of us. We have been across the country and across the globe continuing to fight this pandemic, which has been a challenge no matter where you live, no matter where you are, and no matter what are the circumstances. It has impacted everyone's lives. And unfortunately, it has impacted everyone's lives in a way that has been, unfortunately, transformational, in many ways not so great. There have been some good things that have come out of this, but I think all of us can agree that we wish that we never had such a pandemic that we would be dealing with, at least in our lifetimes. I have completed my first week as the Secretary of Health, and I will say that it has been, again, an honor to join Governor Inslee, his team. I had the chance to meet him last week as well, and certainly our Department of Health staff, as well as some partners, including at Seattle King County Public Health. And I will say that as I continue to learn, I am also learning at the same time that we're making decisions. And so I'm doing my best to lean on our incredible Department of Health staff, and many of those you're going to be hearing from shortly. We are learning from each other, though. There are things about my style and my way of leading, which is also going to bring my own flair to things, my own spin on things, and I'm also learning the team. And I do want to emphasize that we are, again, at what I call halftime of this very long process of this pandemic. 2020 is essentially in a football game, and by the way, congratulations to the Seahawks for clinching their playoff berth. And so I'm really excited about that, as somebody who's coming from a couple of communities where our teams have not gotten into the playoffs. It's great to see the Seahawks actually be in this, in the NFC West, and really have the opportunity to compete moving forward. So I do want to give some congratulations and some shout out to the Seahawks. But if we look at it from a football game, it is the first half. And 2020 was the first half, and we're, as in a football game or a basketball game or a soccer match, we're hitting halftime. That's where we are right now, which is the holidays, the new year, a lot of very important activities that are happening, strategies that are being developed, energies that are being re-energized and rekindled as we continue this long year of response. And then certainly looking at 2021, which is the second half. And the second half includes vaccines. And so the good news is that we have now started to see vaccines in the state of Washington and across the country. That's fantastic news. I don't think any of us thought that we were going to be able to say that so quickly or early on in the process, but it also is the challenge of getting those vaccines to people, not just getting those vaccines allocated, but actually getting those vaccines into the arms of people so we can now move forward with protecting those people as we are now moving into the second half of this long one-year process that will be months and months and months before we see any light of day of the end of this pandemic. But there is good news, and that's the good news, is that we are now starting to see the beginning to a light at the end of this long tunnel. And that's why vaccines continue to be such an important therapeutic, such an important preventive, such an important way for us to protect our communities. And I know Governor Inslee and his team, his staff, are absolutely committed to this. And I will tell you, in just the week and a half that I've been on the on the job, I will tell you this has been a focus for both the governor's team as well as the Department of Health team. And I just want to thank everybody for working well together. This is a very difficult time, and I know that everybody wants to get back to normal, but the reality is this pandemic continues to really have taken hold in our state, and we've got to do everything we can to continue to fight the pandemic, which is the reminder of the 3 W's, which is wash your hands, wear your mask, watch your distance, but it's also about the importance of testing. Testing is the cornerstone, so we want to make sure we encourage people to get tested, especially if they've been exposed to somebody that is a confirmed case of COVID-19, or they have some symptoms that are developing, or they've been contacted by a contact tracer who's told them to get tested. And then finally, the last leg of this is vaccination. And it's not just the process about vaccines, that's great, but it's also the process of vaccination, which is very different than just having vaccines. It's making sure that people in our state have the ability to get vaccinated. And we're starting with healthcare workers and certainly those who are in the long-term care facilities. We've also made a change to that guidance just this morning. And so I want our team to be able to talk about that. So let me just close by saying thank you again for the warm welcome to Washington. I'm learning a lot every single day, but I'm also very honored and proud to join this incredible team, the team at the Department of Health, the team at the governor's office under the leadership of the governor. And frankly, I have to say all the other amazing partners who have been in both the public and private sector, who have reached out and really want to be part of the solution as we move forward. And we will get past this pandemic eventually. It's just going to take all of us to be in it together. So with that, let me turn it back.
Thank you, Dr. Shaw. Next, we'll go to Michelle Roberts.
Great. Good afternoon, everybody. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team and work here at the department. I'm going to share my screen now, so give me a moment.
There we go. We got it.
Okay.
Thank you.
Thank you. I'm going to share my screen now because I have a few slides to just help on the numbers we've been giving out, and hopefully that will make it easier for understanding. And then I'll take the slides down and have a few more remarks about what's going on here in Washington. So as far as numbers to share around vaccines, we expect to receive more vaccine this week. And so here are the numbers for what we're receiving this week. 57,500 doses of the Pfizer BioNTech vaccine and about 44,500 doses of the Moderna vaccine. That is the numbers of vaccine coming into our state this week. From the supply, about 43,375 doses of vaccine will go to 87 sites in 26 counties. In addition, 650,000 doses will go to long-term care facilities and to 17 tribes and urban Indian health programs. Okay, so now I'm just going into some other updates we have. So I just shared that we've got quite a few vaccines starting to go to long-term care facilities, and I'm pleased to share that vaccinations have started for residents and staff of long-term care facilities. One long-term care pharmacy registered through the Department of Health's COVID-19 vaccine provider program began vaccinations for long-term care facilities on December 21st. This week, under the Federal Pharmacy Partnership Program, Walgreens and CVS have several on-site vaccination clinics planned specifically for long-term care facility residents and staff. We love to see progress like this and see the partnerships come together quickly so that we can get our high-risk folks protected by this vaccine as quickly as possible. CVS and Walgreens have shared a goal to complete the first dose vaccinations in skilled nursing facilities in the next 3 weeks. So we'll keep you posted. And like Secretary Shaw said, we need to get vaccines to more people and we need to do it fast. And a key piece of that is provider enrollment. We need providers to enroll now for future phases so that there's no delay in rolling out the vaccine out in the coming weeks and months. We also need to make sure that at the ground level, if a provider runs out of 1A people to give vaccine, but they have extra doses, they can use their clinical decision and clinical judgment to give any remaining doses to other healthcare workers, so that we're not wasting any dosage. Our goal is to vaccinate millions of people in 2021, and that's going to take a lot of coordination and fast action on all of our parts to get it done. Finally, we know that many of people's number one question right now is who's next with vaccine prioritization. We hopefully will have these answers by early next week. We're using the broad ACIP guidance as a framework, but we're going to need to prioritize within it to match projected vaccine supplies. Governor Inslee is playing a crucial role in this decision-making process alongside public health experts here at DOH and building on the input we have received from communities and partners. When this document is available, it will be published on the DOH website and we'll let you all know with a press release. It will include information about the underlying decisions about how decisions were made. So that's it for me today. And thanks to everybody who's doing all the work to help ensure vaccine is getting into arms. And just my weekly reminder, even though you may not be eligible for a COVID-19 vaccine yet, we still need to make sure everybody is getting a flu vaccine this year. And there is plenty of vaccine available. And so we really encourage you, if you've not gotten your flu vaccine yet, now is the time. So please call your pharmacy or healthcare provider and get your flu vaccine.
Next, we'll go to Dr. Scott Lindquist.
Okay, and I have some slides, so I need to share my screen here, Corey. If you could, I don't have that option right now. There we go. Okay, so every week we're giving you some updates. Oh, by the way, happy holidays, everyone. Good to be able to talk to you. But every week we're going to share these slides, and a reminder that a lot of this epidemiology is on the web page. We have a whole team of folks gathering this data so that we in real time can share some of this epidemiology with you. Rather than just go over the same things every week, I'm going to give you some insight and highlights of the week. And there are some trends here. So this is the number of tests that we're doing in Washington State since the very beginning. And you can see we're doing testing like we've never done before, a high rate of testing. But you do see a dip here during the holidays. And then you see this somewhat stalled out period and a starting of a downward trend. This is something that we are seeing. You can see this dashed line is really in the periods where we don't have full data yet. So I don't want you to interpret that. I think what's probably most important is this black line that's flattened and going down in the number of tests. That's really the theme of a lot of our indicators. And again, the entire state is not the same. There are definitely hot spots around the state, and it remains this core cluster of Snohomish, King, and Pierce, along with Yakima, and then these other metropolitan centers like Clark County. So this is Vancouver right on the border with Portland, and Spokane right on the border with Idaho. So those still remain our hotspots within the state. You can see our total case count is actually over 229,000 now. These were data from yesterday. You can look at our hospitalizations and our total cases. What's interesting here is this is what we call an epicurve. This is a number of case counts since the beginning of time. Again, the small bump in the very beginning, flattening and actual decrease as we did social distancing. Another bump in cases and flattening as we again did social restrictions and distancing, and puts us right here. And again, this is the same similar message as last week. We are in a very precarious position. This is the highest rate of cases in Washington State since the beginning, but we're starting to see this downward trend. This is all very encouraging. Again, a lot of social distancing and restrictions put in place. And again, don't interpret this partial data yet until it's complete, but this is actually a good sign for us that we're seeing some downward movement. Again, I really like this slide because it tells us not just that we're pretty equally split in cases by sex, male and female, but it really shows us the age group that is the driver of many of our cases in Washington State, and that is the 20 to 39-year-olds. These are the folks that are out in the public, are working, not to say that people in their 40s to 59 aren't working, that's me, but it really shows you the impact on this in the 80 plus and the 60 to 79-year-olds is much less than that in the 20 to 39-year-old age group. So really concentrating messaging to 20 to 39-year-olds is a big goal for Washington State. And again, there's a lot of indicators about hospitalizations. I like this one, not that it's the best one, but it is one that I've known since the very beginning that showed us that we had very high rates. So look way back. This is, by the way, COVID-like illness hospitalizations. Way back in time, a lot of our hospitalizations were driven by this group here, which is the 0 to 19-year-olds. And if you watch this over time, it has become less and less of the predominant group that is hospitalized with COVID-like illness. And again, some good news here. We definitely peaked and are seeing a little bit of flattening here, a little concern that we don't fully understand the effect in this gray zone of what hospitalizations will look like post-Christmas. I'm optimistic but cautious about this. I think the point is we are still in a precarious position for hospitalizations in this area, which is higher than over the last couple years. Okay, so something new that I would like to talk to you guys about is really looking at a report that we create about every 2 weeks. It looks at the number of outbreaks across Washington State. And this is an interesting outbreak curve here, which shows, yeah, we had a clump of outbreaks here, we had a clump of outbreaks here, and we have this pretty large clump of outbreaks really around November. These are non-healthcare settings. And if you look at the scale, they're on the scale of about 150 per each reporting period. They are starting to trend down, but again, we do have some delay in reporting of outbreaks. But still showing us we have a pretty robust number of outbreaks across Washington State. Maybe a bit of decrease here in the last couple weeks, but again, bringing your attention to 150 is kind of the high mark here. Whereas when we compare that to the long-term care facilities, it's much less epidemic, and it really is kind of a low level of ongoing outbreaks in long-term care facilities. And the total here is about 1,500. So when people ask, where are most of the outbreaks? The answer is it's in our long-term care and our healthcare settings. But to make this point, when we look at our non-healthcare settings where the outbreaks have occurred, the largest number of outbreaks ever reported, 221, were occurring in food service and restaurants. Again, remember, I just said there were about 1,500 in the long-term care facilities. So this is obviously a smaller scale than long-term care, but food service, restaurants, shelters, and homeless services, construction, childcare, agriculture have been the big drivers ever reported. But as we put restaurant restrictions into place, reporting in the most recent week, we had no outbreaks in food service and restaurants reported. The largest number were occurring in shelters and homeless service. So the summary here of these slides is basically we're in a precarious position. We're the highest we've been since the beginning, but we are starting to see some downward trends in cases and possibly hospitalizations, but we continue to have outbreaks in settings. The restrictions put in place for restaurants has clearly affected the number of outbreaks in restaurants in the most recent reporting period. And with that, I'll turn it back to you.
Good afternoon, everyone. Happy New Year. A few updates for you today. I want to do a quick update on the new variant of coronavirus that you heard about last week, first detected in the UK, and a reminder that we are seeing studies that suggest that this variant may spread more easily from person to person, but not yet seeing evidence that infections caused by this variant cause more severe disease. Yesterday, Colorado reported the first confirmed case in the United States of this variant. This person in Colorado did not have a travel history, so this is a sign that the variant is here, though we don't know the degree to which. As of right now, there are no known cases in Washington State or elsewhere in the US, but we know that this could change and likely will change. So I want to share some updates on what we're doing to track this here in Washington, should it show up. We have been and currently send, and will continue to send samples from positive COVID-19 tests in for sequencing to find the genetic fingerprint. And that's how we identify these variants and track transmission of them. In addition, the CDC has instituted additional sequencing of strains through public health labs nationwide. And we're also on heightened alert for any positive COVID tests we have among travelers who have recently been in countries where this variant of the SARS virus, known as B117, or by its mutation name N501Y, has been identified. The good news is that in addition to tracking this, we know how to slow the spread of this variant and all variants of COVID-19. As a reminder, travelers arriving from countries where this variant is circulated are required to quarantine for 14 days under governor's proclamation here in Washington. In addition, travelers coming from certain countries are required to get a negative test result before they board their plane, and that's a federal policy. And then I want to remind everyone that in Washington State, we have a travel advisory recommending that anyone who travels quarantine upon their arrival here. And that's an important tool to help us stop the spread. It's also imperative that we keep up all of the mitigation measures that we know are working. And you heard Dr. Shaw talking about these: wearing masks and watching our distance anytime we're around people from outside of our household, washing or sanitizing our hands frequently, avoiding crowded, confined, or poorly ventilated spaces, limiting our gatherings and travel, and getting tested when we experience symptoms or if we find out we're a close contact of someone who has COVID-19. The more we do these things and the more of us who do them, the better they work. Another tool that we have is WA Notify, and you'll remember that at the very end of November, we launched this, and it's a smartphone notification tool that helps you find out if you've been exposed to COVID-19. This is an anonymous tool. It does not track your personal information or your location. We are delighted that we have 1.6 million users here in our state. That's more than 26% of our adult population in Washington. And this is great news because the more people who use this, the better it works to help us stop the chains of transmission. Through this system, people can learn very quickly that they might have been exposed, and that allows them to quarantine and get tested. If you were an early WA Notifier adopter, first of all, thank you for helping us to slow the spread. And secondly, you may have seen or will see soon a new pop-up asking you to voluntarily share WA Notified data with public health. If you agree, the Department of Health will receive some key metrics at the state level only, so not personal level. These would be data like the number of verification codes issued or the number of codes entered. Your privacy will still be protected. Again, no personal information collected or shared as part of this process, and no way for us here at DOH to identify you. I also want to remind people who are using WA Notify that once you enable it, it's working quietly in the background of your phone. And if you don't hear anything, that is not a sign that anything's wrong. You'll only get something from WA Notify if somebody that you interacted with and were in close contact with for a period of time tests positive and enters a verification code. So no news is good news. And if you want to just make sure it's still on, you can pop up your phone and open the app, and it'll actually tell you have no recent exposures. So remember, no news, good news. One last quick update on vaccines. So far in Washington State, we've vaccinated 59,491 people. These are primarily high-risk workers in healthcare settings and people in long-term care facilities. There are some communities here in Washington that have already completed or are very near to completing vaccination of their high-risk workers in healthcare environments, as is outlined in our guidance for Phase 1A. And so today we've added a second tier to 1A that allows for the vaccination of all other workers in healthcare settings once those high-risk workers are vaccinated. This will help us protect more of our healthcare system so that they can protect us and our communities. We acknowledge that some communities are working through 1A and will still need more time to do this, while others will be able to move forward a little more quickly. Across Washington, it is important to note that healthcare systems are a key partner in this, and they will be helping us in public health to reach out to community-based healthcare workforce in their communities so that we can reach these other healthcare providers, such as behavioral healthcare providers, primary care, school nurses, and others to help get more of our healthcare system protected before we move on to phase 1B. We are still working to finalize prioritization for 1B and C, as you've heard. We expect to release this guidance shortly and planning outreach to get this vaccination underway early next year. With that, I want to thank everyone in Washington for all that you've done to protect yourself, your family, your friends, and communities in this very challenging year. We know that it has not been easy. Let's keep doing more as we move into 2021 and through the pandemic to the light at the end of that tunnel. And with that, I will wish everyone a happy, healthy, hopeful new year and turn it back to you, Corey.
Next, we'll go to Dr. Kira Mawson.
Hi, everybody. Good afternoon. Today, I want to kind of revisit something that we've talked about before in the context of the new year, which is about how resilience might look heading into 2021 and how we can sort of use that and leverage the different components and ingredients of resilience to really get through the second half of the game, as Dr. Shaw was mentioning earlier, after halftime has concluded. So obviously, most of us are really happy to have 2020 in the rear view here. But just because the calendar is turning over doesn't mean that the general circumstances that we're experiencing are different. It doesn't put us out of the pandemic, not yet. So I've mentioned previously that having hope is one of those key ingredients of resilience, and that is definitely still just as true as it ever has been. But I also want to focus a little bit on the other ingredients as well. So with vaccine distribution underway, hope obviously plays a very important role in the experience of the next several months. It's important to keep that in mind. But along with hope, we also have purpose, connection, and flexibility and adaptability. And those are the other ingredients of resilience that we can work on developing intentionally and kind of put that in the goal category if that's something that would be of interest to you. So as many of us set new goals or make New Year's resolutions, keeping in mind those elements of resilience in the background is going to be really helpful from a behavioral health perspective. So purpose is that first one. And obviously that's something that's been really tricky for folks in the last several months. So many of us have struggled with motivation, finding purpose or sort of reevaluating our motivation throughout this pandemic and questioning sort of why we do what we do. But when we think about purpose in the new year, one of the most important pieces of that is the scope and the size of our motivations and goals. And that's often where things go sideways for people. So what do we want to achieve and how reasonable is it in the context of this pandemic? Easily one of the most common mistakes that people make when setting goals is that they're too big. And because they're too big, they're not usually reasonable to attain. So the same thing can be said for New Year's resolutions. We need to keep in mind what's reasonable under the circumstances of this disaster. We know and recognize that stress eating is a common thing. Craving carbohydrates certainly has been a common occurrence. And many people typically have goals about fitness or weight loss in January anyway. And those are great goals. But again, they need to be the right size and the right scope for you. So getting off the couch and deciding to run a marathon by March 1st or losing 20 pounds in a month not only isn't reasonable from a health perspective, but it could potentially be physically harmful as well. So the other thing that we risk is that if we set our goals too big, if it isn't achieved, then we can feel let down and we can have some sadness or depression that kind of goes along with that if we're not able to make it. So as we define purpose in 2021, we need to keep our goals and motivations reasonable and attainable. The big vacation that you didn't get to take last year may be a big motivator still in 2021, and there's nothing wrong with that. But until you can get to that big vacation, try to set smaller, more attainable goals in the short term. So practicing success by making and achieving those things feels great. That's what's going to contribute to happiness and our sense of control and efficacy and accomplishment as we move forward. Connection is the second ingredient of resilience after purpose. And remember that connection can be anything that prevents us from being isolated. So that can include things like sharing time with friends and family, creatively and safely, or just anything that's connecting us to something that's bigger than ourselves. Pets or a social cause or issue, there's no wrong way to experience connection. We continue to prioritize connections with other people, as hard as that might be, especially in these dark winter months when we aren't getting out and doing as much as we usually do. So it's challenging, but it's very rewarding when we can do it. So we're meant to be connected to others. And then the last ingredient is this concept of flexibility and adaptability. And that's often the hardest one for people. It also is directly related to goal setting and resolutions. So setting achievable goals means being willing to be flexible and to adjust our expectations around performance and success, as we've had to do for all year, so that we're more likely to complete what we set out to do. And for goals and resolutions, this means adapting them and being somewhat flexible with them too. So for example, if you have a fitness goal, try to avoid making it too large scale. Instead, maybe give yourself a menu of options. You can create a list of things that are smaller scale. Maybe rather than planning to work out every day for an hour, which can feel very daunting, make a list of reasonable options like short walks, stretching or meditation, or something from your menu that works for you. So that rather than being rigid and stuck on, I have to do this day, that we're a little bit more flexible around how to meet the goals that we want for ourselves. And that takes time. So flexibility and adaptability is a piece of resilience that plays out for all of us, and it's important for sure. That also includes having patience, sort of rolling with stuff when it changes, for patience for ourselves, patience for our family members and strangers too. Trying to make the most of the things that are unexpected is a skill that can be practiced and developed. So these ingredients for resilience, hope, purpose, connection, and flexibility and adaptability, they will serve us well even when this is over, right? So practicing it now and developing these skills now is a key thing that will help get us through this disaster, but also sort of later on in life as well. If you'd like more information on this, you can check out the website, the coronavirus.wa.gov /mental and emotional well-being page. It has lots of different documents and sources that might be helpful too. So I think that's it for me. Thank you very much.
Thank you, Dr. Mathis. Before we move into media Q&A, I would like to pass the mic back to our panel for any additional remarks.
Corey, thank you. First of all, thank you to fellow DOH colleagues here who have, I thought, done a really amazing job of providing different insights from both the testing side and the healthcare side, from statistics, and also on the vaccination side, certainly the behavioral health side, and then really even some of the science around the UK strain, and then certainly looking at additional operational considerations. I spoke with the governor just this morning, shortly ago, and we agreed that we need to deliver a vaccine as quickly as possible, and we have to get it to the right people as quickly as possible. And so that's the reason, as Lacey and Michelle pointed out, that's the reason that we made this additional pivot, if you will, to add to or augment our 1A category, because we want to make sure that ultimately vaccine gets out as quickly as possible to the state of Washington. And as Lacey pointed out, with just shy of 60,000 people across the state, we've got a lot of work to do. And we are going to do that work, but it is going to take time. And we want to make sure that we are giving as much flexibility to our healthcare partners, but at the same time, we recognize the absolute importance of protecting our healthcare workers who, as we know, have been putting their heart and soul as well as their lives on the line to protect all of us. And so I just wanted to add those additional pieces and just say that the governor is absolutely committed to not just determining where we are with category 1A, but also what those subsequent determinations are. And we are in active discussions with both him, his team, and all of us at DOH, as well as our partners, so that we can incorporate some of those feedback and inputs into the eventual decisions that are going to be made. So more to come on that, but I wanted to just say that we are connected, and we are doing this because we recognize the absolute importance of getting vaccines out. And it does none of us any good if the vaccine is sitting on a shelf. We want to make sure that it's in the arms of people, and that's the most important thing. So unless there's anything else from colleagues, Corey, we can turn it back to you.
All right. With that, this concludes our remarks portion of the briefing, and we'll move into media Q&A. Now, we have a large number of folks in the queue today, so I apologize that we will not be able to get to everyone. That said, we'll be sure to follow up by email afterwards. We're not able to get to you in line. And also, you can reach out to us at doh-pio@doh.wa.gov. As a result of our limited time, we will not offer follow-ups, but again, shoot us an email. We'll work with you. So to begin Q&A, I'll open up to Simone Del Rosario with Q13.
Hi, thanks for taking these questions, and happy holidays to everyone. If I've done my math correct, in the 3 weeks that we've received allocations from the federal government, basically by the end of this week, we expect about 337,150 vaccines will have been sent here to Washington State. I was wondering if you could clarify the total again of the number of vaccines that have been administered to date, and really what I envision is that this is less than 20% of what we will have in this state. So what's slowing down the administration? And because I don't have a follow-up allowed here, just if you can tell me what's slowing down the administration of getting these vaccines to the people who need them, and what would a national strategy do maybe to help benefit that?
Yeah, thanks. I think I'll start on this question, and then if Dr. Shaw or Lacey have anything to add, please go ahead. But great question, and it's something we're watching very closely. So just to be clear, actually, the total doses delivered for Washington is 356,650 doses. And so we've administered 59,491 of those doses, which is about 18.7%. So, and I want to just be clear that this does, the amount administered differs by, it's much higher if we just look at the Pfizer doses, since they were the first vaccines to arrive. Over 50% of the amount of Pfizer vaccine we've gotten in our state has arrived. And that was the vaccine that really started arriving first in week 1 of vaccines. But then if you look at the Moderna vaccine, that really just started arriving in our state Wednesday and Thursday, and some of those orders from last week really arrived on Monday of this week. Only 6.1% of that vaccine has arrived. So, and as far as your question about, there's probably just a ton of different factors going into this. First of all, these are large-scale vaccination efforts that are happening at the local level. And so that really takes a tremendous amount of community planning that we're working to support at the state. So we're really appreciative of our hospital systems and our healthcare providers who are rolling up the sleeves to get those clinics set up and get people scheduled and in. I think part of the challenge for them has been that right now we don't have a predictable delivery schedule from CDC, and we're really working with CDC. That's their goal, to get there. So people who are scheduled to get vaccine, that is not arriving in Washington State all in one day. It's coming in over multiple days. And then, like I said, most of our Moderna vaccine was really delivered on Thursday last week, which was, right on top of the holiday weekend. So I think there's just a little, some of the logistics and timing, and those are all things that will be smoothing out after the new year. We are even seeing doses continue to increase after the holiday weekend, and I think we're going to see this number start to increase quicker. And that's one of the things we're really going to be working, supporting our community partners and our local health departments and others and our health systems to figure out what we can do to help them administer this vaccine quicker. How can we make sure that our large health systems are reaching out to people in their community, others who are eligible for vaccine under 1A who may not have a place to go yet, so we can make sure everybody is eligible, has a place to go, and we can get these doses used up. Dr. Shaw, Lacey, anything to add?
I would just say that I think Michelle covered it. Sorry, I got some echo there. The best laid plans also require a lot of operational on the ground execution. And we, as Michelle said, our goal is to continue to support our local partners, whether in the healthcare system, public health system, or beyond. And really that continues to be our number one goal. The question was also about national strategy. And, there have been challenges on the national perspective on how vaccines have been delivered. We have an incredible amount of real appreciation of our federal partners for obviously even getting to the point where we have vaccines that are available, but really additional pieces of that related to communications and the funding and the logistics, all that come into play. And so we continue to work with our federal partners just as we're working with our local partners. But at the end of the day, as Michelle said, we do see that this is going to improve as we get through some of those initial hiccups, if you will, or challenges or impediments that are in the system. And as we smooth those out, then yeah, absolutely. Our goal is to get more vaccine out in a quicker throughput as quickly as possible.
Our next question comes from Keith Eldridge with Como.
Dr. Shah, since you're the governor's representative, what's the reasoning behind just extending the restrictions for 1 week? Does that signal perhaps an end to the restrictions on January 11th? And is there any hope for bowling alleys and gyms to get open, because they say they are not the source of any of the outbreaks?
Well, thanks for that question. And I will also defer as I'm getting an additional onboarding and information from my staff members and colleagues that are on this. So if Dr. Lindquist in particular wants to add anything to this, feel free to. What I will say is that, as Dr. Lindquist showed in terms of the numbers, we have seen some improvement in what's happening in our healthcare system and the numbers post the Thanksgiving and even the holidays with the additional restrictions that were put in place. But we're not out of the woods here. And I think the key message is that we feel that it's going to require us to go longer. Now, extending it from January 4th through January 11th, I think, one, it gives people some additional information. There's not uncertainty about what's going to happen into the new year. And number two is that we want to continue to see those numbers come down, whether it's in the healthcare system or in the community. We've got to continue to work on this and be able to drive those numbers down. And so that's the reason for that extension. Now, whether that gets into other sectors or how, those are the things that we're looking at actively on a daily basis. Scott, do you have anything to add?
Yeah, I guess I would add, it's a really hard thing to say that you're not a source of the outbreak when your restrictions are in place so that you aren't having any numbers. I mean, as you see in the restaurants this week, there were no restaurants identified, but that's because they're closed. There's no bowling alleys or gyms showing cases because they're restricted. So it's a really difficult thing to make blanket statements about, but to the best of our knowledge right now, you're correct, we are not having outbreaks in bowling alleys and gyms.
Our next question comes from Jerry Cornfield with the Daily Herald.
I wondered if you could clarify for us, where are these cases of providers finding themselves with extra or unused doses, and so they're able to, and they are already administering them to non-phase 1A folks so that those doses aren't wasted and expired? Where's that occurring?
Yeah, I think that can concur in many different settings. So remember that these are vials of vaccine that either have, that have a set number of doses, kind of 5 to 10, depending on each type of the vaccine. And then once you've kind of thawed and that vial of vaccine is ready to go, you have to use that vial within a certain number of hours, usually around 5. So that's one example. So maybe you're running a clinic and at the end of the day, there's nobody else right there, or just it's your regular patient population coming through. So we don't want to throw away the last 2 couple remaining doses when there's somebody who could be protected from the vaccine, which is going to benefit our entire community. So that's one piece. And that type of situation could happen in any provider across our state. Also, too, another piece of what's happening is in our more rural communities who got doses of Pfizer vaccine, kind of in the first week, because they were really working to make sure early on, and we still are, to make sure there's vaccine available in every county across the state. Some of our smaller counties have less healthcare providers and less people who are in that first tier of 1A. We really want to make sure that they're able to use up the remaining vaccine that they have, and we can meet their needs, as we're also continuing to work on some of our more populous counties who have many more healthcare providers, and we continue to get more vaccine to them so we can make sure everybody who's eligible under 1A has a vaccine.
Our next question comes from Eilish O'Neill with KUOW.
Hi, I think this is probably for Michelle Roberts. You mentioned that one pharmacy has started administering vaccines in long-term care facilities. I was wondering how many facilities and also how many staff and residents of long-term care facilities have already been vaccinated, and how many facilities are scheduled for this week?
Yeah, I think we can follow up with the exact numbers via email afterwards. There's two different, I'll kind of review what I shared earlier. So vaccination of long-term care residents really started last week with one of the pharmacy chains that serves a lot of the long-term care facilities in our state. So that started happening this last week. And then this week, for the federal partnership program with CVS and Walgreens kicked in, and they are prioritizing skilled nursing facilities. So those are where patients need the highest levels of care in long-term care. And they are working to get all the first dose visits done for those facilities in the next 30 weeks. So we can definitely give you information on what we have on the number of facilities from what we know from CVS and Walgreens that is scheduled. So we can follow up with the information we have. But again, the exact date of all those visits being scheduled is really being, the state is not scheduling those. That is happening in a discussion between the pharmacies and then the long-term care to really pick a date that works best for both of those sides of the organizations who are making this partnership successful.
Our next question comes from Evan Bush with the Seattle Times.
Yeah, this is probably a question for Michelle as well. I'm wondering how many reports of vaccine excursion have been made to the Department of Health, and how many doses have gone to waste so far. And if you could put as many numbers and context around that as possible, please. Thank you.
Yeah, thanks, Evan. Great question. I actually don't have the exact numbers on that, but it is information we are watching. So we can continue to make sure we report on that, and we can follow up also via email with specific information. It's pretty minimal now. We do just have all the time, and this is pretty regular for all of our vaccine work, just questions from the providers about, what they're seeing with their temperature monitoring. And then we're really working to help look at that data with them. And if there's any question about vaccines being out of the allowable range for temperatures, there's a process to reach out to the manufacturers to share that information. And the manufacturers really give us advice on if those doses of vaccine are still viable.
Our next question comes from Drew Mickelson with King 5.
Good afternoon. Ms. Roberts, the question might be best for you. So it sounds like next week we'll find out who is in that 1B group, the next group to get the vaccines. When can those folks expect to roll their sleeves up? And how will the state notify them? Will it be a personal notification? Will it be a job classification? What are the logistics as we move to the next phase?
Yeah, great question. Yeah, we're hoping to start sharing the information, like we said, about who's next next week. And then we hope that we'll be able to officially have a start date as far as when they can start getting vaccinated later in January. So we really want to start sharing the information so people kind of heads up about what's coming, and then we can get that on the ground planning that we were talking about. So making sure the facilities are ready, the providers that would serve the populations that are next are enrolled and they're ready to start receiving vaccine. So that is the goal. So kind of notification of what's coming next week, and then hopefully kind of mid to late January, starting the next group to offer vaccine to them. As far as how will people know, we hope that everybody who's going to be eligible for vaccine will hear that message multiple ways. So we hope we'll continue to make sure our media campaign and our community outreach has that information. We'll have the providers who would serve these groups, whoever is next, will be able to reach out Employers will also share that information. So we're going to distribute it far and wide with the hopes that any individual could potentially hear from their primary care provider. They may see an ad on their social media or when they're watching the news. They'll also, if they're getting any community services, those providers will help notify them. So it's really going to be kind of a multifaceted campaign that's going to be in multiple places. So, so everybody will have the information they need.
Our next question comes from Sarah Jensler with McClatchy.
This is for Michelle as well. Could communities you mentioned that have nearly vaccinated all people in that first tier of 1A see a pause in allocations so that places that haven't done that can keep working toward that goal? Or with the new tier, will they continue to receive allocations and just direct them toward other healthcare workers?
Yeah, that's a great question. You know, we're trying to move as a state as a unified approach as much as possible, but recognizing there really are geographic differences happening here. So we'll continue to make sure our more populous counties have larger allocations of vaccine. That's already been happening, and it's definitely one of the things that needs to happen over the next couple of weeks to make sure they have enough vaccine to get through all of their 1A population. And then that's exactly why we've done this expansion of who else can be considered in 1A and moving beyond just the highest risk healthcare workers to all healthcare or all workers in a healthcare setting who otherwise have not been covered, to really help those maybe smaller rural communities who have really worked through all their high risk 1A populations so that they can keep vaccinating with any remaining supplies over the next couple of weeks.
Yeah, if I can just, Michelle, add in.
Yeah, please.
Sorry, I think there's there you go. So what I just wanted to add into that is that one of the things that we're recognizing as both Michelle and by the way, it's fantastic when all the questions go to one person because I love it. That's great. So I'm sure Michelle doesn't, but it's great to hear the answers. Michelle and Lacey both pointed out that, you know, really our goal is to expand to more healthcare workers, which, you know, as we've talked about, that can be in the outpatient setting. It can be, you know, a broader look at healthcare, you know, from the mom and pop doctor's office that's not affiliated with a system, dental offices, you know, ENT or pulmonary, you know, there are so many different kinds of activities in the health system that actually may put the individual at risk. And what I wanted to also say is that we are also working with our hospital and healthcare partners, and they've done a fantastic job to date. We want to continue to work with them as they move towards completing their healthcare workforce that's part of their health system. We want to also encourage them to be thinking about how there are any gaps in their communities, how they may be able to help us be able to also get those individuals, again, the mom and pop physician office or medical practice or dental practice or what other kind of other activities put people at risk. And there may be people who are not healthcare providers who are not aware where they can get vaccinated. And there may be a healthcare system that's right down the street that might be able to help get the vaccination done. We want to make sure to encourage that as well.
Our next question comes from Kelly Azar with K2.
Thank you so much for taking the time. I have a question about the variant, and it's a two-part question, so bear with me. Will the vaccine that we currently have or vaccines that we currently have work against this new variant? Also, do we expect over time for there to be other variants, and how do we protect against them?
Yeah, I can take this one. So there is no evidence that this variant is resistant to the vaccine. But again, as time goes on, we'll have more evidence of supporting or refuting this. But there is no evidence at this time, one, that it's more deadly, or two, that it's going to evade immune systems or vaccines. So that's a quick answer. The other question is a really complicated question. There are variants. That's the thing about viruses. They tend to mutate quite frequently. We've seen multiple variants over time, even here in Washington State since the very first strain. But the point is to do surveillance for any new strains that are associated with any changes in presentation, like being more deadly or more infectious. Now, to be very clear, this virus is found to be more infectious based on epidemiology, not based on any mutations found within the virus. And that basically is that in the UK, they've found since September that this is the predominant strain. So in a 3-month time period, this has become infectious enough to be the most predominant strain. The caveat to that, though, is of anyone in the world that does genotyping more than anybody, it's the United Kingdom. So we're not surprised that they see it first. And again, like Lacey explained earlier, we have a very active genotype surveillance system that we're actually ramping up at this point.
And, to follow that, the question of how we stop this, whether it's this variant or any other variant, as Dr. Lindquist said, these viruses are always mutating and new variants coming out. It's those mitigation measures that we talked about. So wearing your mask, watching your distance, limiting your gatherings, these are things that stop chains of transmission of any coronavirus. So that's what we really need people to do. We suppress the numbers of people infected, the burden of disease, and keep that really, really low. And that allows us to contain with the test, isolate, trace strategy. And that's how we stop this while we keep vaccinating more and more people and moving forward.
And I just want to add to what Scott and Lacey just said, which is when your place in the queue for vaccination is called, we do not want people to hesitate because of any news or information such as the UK strain. This is really, again, very critical that right now, as was mentioned, while you're waiting, get your flu shot, get your flu vaccine. And in the meantime, when you're in the category where it's time for you to get vaccinated, and we know we're working through all this, and it's going to take time to get all the vaccines in our state, in our community, and eventually into the arms of people. But when your name is called, so to speak, we want to make sure that you don't hesitate, you vaccinate. And I think that's a key message. Don't hesitate, vaccinate. And that's something we are going to continue to say, not just because of influenza and flu vaccine, but also because of COVID vaccine. And we want to make sure that's emphasized. So we don't want to provide anyone a reason not to get vaccinated because of a concern for a mutated strain or a UK strain or something else. We have no evidence that the vaccine is less effective right now based on what we know, and we're going to continue to do everything we can to monitor that. But that should not be a reason for someone to say, I'm just not going to get vaccinated.
Our final question for today comes from Essex Porter with Cairo 7.
Yes, hello. A question about long-term care facilities. Some of the long-term care facilities have mixed population. People who need skilled nursing, people who are doing assisted living, some are doing independent living. When the vaccinations arrive for those who need skilled nursing, should they also vaccinate those who need assisted living or independent living, since they're all in the same facility?
Yeah, great question. So that is definitely an option. All the different types of facilities in these locations are eligible. And so that's really kind of part of the planning that's happening between the pharmacies and the long-term care facilities. And the federal program, and actually even in the state, it's going to require multiple visits back anyways to each facility, at least 3 and possibly 4. People are going to need the first dose, and then you're going to need to come back to do the second dose, and there'll be staff and residents who were missed the first time. So that is going to continue to happen over time. But yeah, we are trying to make it as seamless as possible, and that's the goal of these pharmacy systems as well. Like, how can we make sure everybody is vaccinated as soon as possible? So I said that they're concentrating on the skilled nursing facilities first, but they're really expanding visits to all starting next week.
All right, with that, we'll conclude today's COVID-19 response update media briefing, and we'll look forward to convening again next week. You can find this briefing and past briefings archived at tvw.org or on the Washington State Department of Health YouTube account. I want to thank our panelists for making time, and have a safe and healthy new year.